We have heard health experts warn about the twindemic that could occur when flu season combines with the COVID-19 pandemic. However, a recent survey by the National Poll on Children's Health showed that some parents aren't concerned about vaccinating their kids against the flu. Nine health expert Dr. Payal Kohli is joining us today to talk about what every parent needs to know. So how and why are parents approaching the flu vaccine this way, Dr. Kohli?
So Kim, the results of this survey really surprised me, I'll have to be honest. So it was about 2,000 parents with kids aged 2 through 18 that were asked about their attitudes about vaccination this year. And 1 out of 3 parents said they don't plan to give their child the flu vaccine this year. And 2 out of 3 parents said that they don't believe that the flu vaccination is important this year, despite obviously the public health messages they've been hearing from health experts. And the reasons for this were the usual lineup. So some of them were that they don't believe that the flu vaccine is effective. They have concerns about safety. Those types of issues come up every year. But specific to this year, was 1 out of 7 parents saying that they're worried that their child may have a higher risk of COVID if they have the flu vaccine. So I really do want to take this opportunity to assure parents not only is the vaccine safe for your child, but it also is safe, especially during a pandemic, to take your child to get vaccinated. And in fact, probably all the more important than ever.
Yeah, and we've done so much about the fact trying to distinguish between what's flu and what's COVID. And if you get the vaccine, at least you might have some other ideas going on there. So what's the risk of not getting vaccinated, not getting your child vaccinated?
So like you said, we've been talking a lot about flu and COVID. And with COVID, the great thing is that if kids get sick, their chance of having severe complications is very low. That's not true with flu. So if kids get sick, their chance of complications, some even life-threatening complications, can be quite high. In fact, kids under the age of 5 are some of the highest risk of dying from flu. Last year, there were 188 pediatric deaths reported by the CDC due to flu. And Kim, what we're seeing is not only that parents are resistant to vaccinating kids against the flu, but in Michigan, for example, there have been significant drops in vaccination for other diseases like measles and pertussis. So my fear is that this pandemic is going to start affecting our kids indirectly because we're now not vaccinating them against illnesses that we could prevent, and more preventable deaths could occur.
Oh, that's terrifying. So the recommendation for the flu vaccine for kids, what age and when should we get it?
So all children over the age of 6 months should have flu vaccine. If they're under the age of 9 and they have not had 2 previous doses of the flu vaccine, then they actually need 2 doses within the same season, separated by 1 month. If they're over the age of 9, they only need the 1 single dose. You obviously want to be mindful if your child has food allergies to get a special egg-free vaccine. And then a lot of parents, Kim, ask about the FluMist, which is a way to get the vaccine without getting the needle in the arm. And actually, the American Academy of Pediatrics is not recommending the intranasal FluMist. They want the shot in the arm instead because it's been shown to be more efficacious in the past and because you can't get sick from it. It's the inactivated version as opposed to the live one in the nose. So even though it's a little harder to convince kids, I do think it's important to get them that shot in the arm or the leg.
Yeah, do that instead of the nose anyway. I don't know. And the 9 Health Fair can do this. You can get free flu shots, right?
Absolutely right. Yeah, you can go to the 9 Health Fair and get in and out with getting your kids and yourself vaccinated. Now's the perfect time. October 1st is right around the corner, so it's a great window for you to get it.
Okay. Well, we hope everybody listens and makes notes of that. We don't need our kids getting sick too. There's too much to worry about. Thank you, Dr. Kohli.